This skill video is for eye medications, eye drops, or ointments. In this specific video, I will be demonstrating how to use the eye drops. So first I would check the MAR, check, the patient's name, the medication, the dose of the medication, how many drops are to be given, whether both eyes are to be treated or just one eye is to be treated. And on the MAR, there will always be specific instructions. So you want to make sure that you read that and understand before you go to administer the eye drops. I'm going to wash my hands with soap and water prior to administering any eye medication to avoid germs and causing infection, and always put on clean gloves before administering. So I would knock on the patient's door, tell them the medication that I'm to be administering, and ask for permission, explain the procedure, provide them privacy by shutting the door, pulling the curtain, whatever setting that you may be in. I would remove the lid from the eye drop bottle and lay it on a clean surface. And it's very important not to let the tip of the dropper touch anything. It can be contaminated, and it'll prevent any kind of infections. You also don't want the tip or the dropper to touch the client's eyes, eyelashes, nor your hands or fingers, because germs will get on the dropper. The only thing that the dropper should touch, or the tube or whatever eye medication you're using, is the medicine from the bottle or tube. So I would assist the client to a comfortable position and ask them to gently tilt their head back, or lie down, resting their head on a pillow. Also, I could get assistance if I feel the need to, depending on the client's state of mind, whether they have dementia, if it's a child, any of those things. So I would instruct the patient to tilt their head back, looking at the ceiling, and avoid hyperextending the neck, so that there are no injuries that occur. And you always want to make sure you are putting the eye drops in the correct eye, needing the medication. So if it says left or right eye, it's going to be the client's left or right eye. Just don't go by your left and right. So for the drops, I would, I tell the client to look up and away with the client's permission, use my index finger and pull down the lower eyelid. This will create a pocket, as you can see. And to prevent the medication from being squeezed out of the eye, warn the client not to close their eyes tightly, or squeeze them shut. So I would drop the exact number of drops listed on the MAR into the eye or eyes, into the pocket without touching the dropper to the eye or the eyelid. It's helpful to rest your hand on the client's forehead to steady the dropper, and do not let the tip of the dropper touch anything during administration. That is very important. Otherwise, you're just putting the germs from their eye onto the dropper, or from your hands, or whatever the case may be. Administer the drops in the correct order and at the right time according to the MAR. Gently press the corner of the eye at the bridge of the nose for 1 minute, and this will prevent the medication from draining into the mouth. So then I would replace and wipe off the tip of the applicator or whatever. If you're using a tube or whatnot, if it's a dropper, it shouldn't have touched anything. You put it right back in the bottle. Replace and tighten the cap. Give the client a tissue to wipe away medication that may have run down their face or whatever it is, their cheek, and then store the medication per agency policy, and remove your gloves according to agency policy, and wash your hands, and then document on the MAR that you gave the medication, what time you gave the medication, and etc.